Today on the 50 Shades of Pain show, we're talking about the bane of existence for runners, the IT band. So stay tuned. Welcome to the 50 Shades of Pain show, where we demystify pain, both physical and emotional, to give you the tools that you need for optimal health. I'm Dr. Danish, Medical Director of Wellward here in Lexington, Kentucky. I'm here with my co-host, Dr. James Escaloni. Today, we are talking about hips, and in particular, the IT band, something that every runner I know complains about.
Oh, yeah.
With good reason, too. I mean, the IT band is a major strut of the body. Like, if you look at the way our calves and our hips are built, our forearms, our calves, our hips, our shoulders, there's always a two-bone system supporting it, supporting the main bone. Like in your arm, there are two bones that allows for this kind of rotation. In your ankle, there are two bones. One, the tibia, is the main pillar, but then the fibula is the secondary pillar. But you don't have that in your hip. You've got one thick bone called the femur, and then you've got the IT band in support of it. What we have learned in dissecting IT bands on cadavers is that the anatomy books don't really reflect it properly, right?
Yeah. A lot of people, when they're thinking, okay, I've got these IT band issues that, okay, maybe I just need to get my hips a little bit stronger. Maybe I need to use a foam roller and roll all the way up and down. And that's not a bad thing at all. A lot of people have been helped with this, but that's not everything. There's a lot more to it as we've dug deeper, especially doing cadaveric dissections ourselves, to really understand why are these people not getting better with just foam rolling and getting their hips stronger.
Yeah, so everybody thinks of the IT band. Like if this is your femur, where your hip socket is here, your femur bone is here, the IT band people think of as just one straight line going up and down and supporting the strut on the outside. But it actually wraps around and connects into bone all along the shaft of the femur, and then it fillets out where it starts from the head of the femur and the acetabulum. It fillets out and it kind of branches over the hip like this, and when it gets down to the knee, it does the same thing. It flays out and it branches into the different parts of the knee, making that whole system work as one. People foam roll it because as you run, you can develop small adhesions along the path of that band just from that friction taking place, and that friction causes inflammation. Inflammation causes your body to go into a reactive mode where it tries to thicken and fortify and hold things down. But as we age, we don't have the same level of instructive cells or stem cells that have the blueprints of the body and help decide what goes where. So your body's just kind of going on the fly, and these adhesions develop as we age. Foam rolling it can help to break down some of those adhesions and create greater degree of lubrication in between, called hyaluronic acid, and that helps to keep things supple and moving in the planes that they need to be active in. But so if there are adhesions that start to form that don't break down, then what happens?
Well, then things start to get extra stuck.
Yeah.
And then the joints don't move like they're supposed to.
And things are lubricated and moving the way they are designed because it distributes stresses across multiple different structures within the hip. And if you've got an adhesion, it means that one area is not getting enough stress and one area is getting too much stress. And those areas that are getting too much stress start to break down and cause other problems. So the fact that you've got some IT band issues is not just discomfort right where you're feeling it, it's also causing stresses in other parts of your body and will accelerate the aging and functional decline of that joint.
So for a lot of you at home, when you've been running, you've probably felt that pain on the side of your thigh going from your knee all the way to your hip. And you'll definitely notice that if you've had this issue, you've foam rolled it, you've gotten your glutes stronger, but you still feel this tension keeps on building up and up and up. Well, that's where there's probably something, a little secret spot, a little further up on the hip that's causing everything around there to be misbehaving. What's that little secret muscle?
Are you talking about the tensor fascia latae, or?
Oh, the indirect head of the rectus femoris. Yeah, we see this all the time in people who've had this just pain right here on this spot on the hip. That seems where people say, okay, that's my tensor fascia lata. Your massage therapist, your physical therapist, chiropractors, dig their elbows in there to help it out. What it is, it's part of your quadricep muscle. It has a little tear underneath there. And because all of that stuff works together, then the IT band area on top of it starts to misbehave further and further. So that is what is the big secret. We have found that if you've got that IT band pain, and it seems like it goes away, but keeps on coming back again and again and again, even if you've stopped running, which is sacrilege for runners.
Yeah.
Then this is where that comes in.
I often see people who have labral tears also have that issue. And for a long time, it was kind of mysterious to me until we got into some cadavers and dissected it and looked at it in closer detail and found that indirect head of the rectus femoris is actually attaching to the same spots where the labrum sits and the joint capsule sits. So if you start to develop tendinitis there, it's a chicken and the egg scenario where it's unclear if that's happening because the labrum has torn or the labrum tore because that area was misfiring and dysfunctioning. So the sum of it is, what can people do to help keep their IT bands healthy?
One of the first things is, like I said already, try the basics that have been proven to work. Get your glutes, your hips stronger. Try to use that foam rolling so that that soft tissue is moving well, nicely lubricated in those hyaluronic acid chains on the sides of your leg. See how that goes. And if it just seems like everything's getting better, but it's just focusing in on one area that's not getting better, maybe put a little bit more emphasis right at that spot on the side of your hip. See what goes on. Now, if you're still having that pain on that same spot, it still feels tight, everything's kind of achy from there, and you keep on feeling like, man, I just got to dig my elbow in there again and again and again, you probably have some sort of small tear there. And that's where we can come in to help that.
Yeah, a lot of people label it as bursitis, but almost never it's bursitis. Bursas become irritated when tendons are problematic and they're not doing their job or not creating appropriate lubrication. So if you've been labeled as having bursitis or having IT band issues and it's not going away after, say, what, 6 months?
Oh, yeah.
Then it's time for you to come in and be seen, and we can take an ultrasound, look at it in finer detail, figure out exactly what's going on and where the tears are, and then use exercise, prolotherapy, PRP, different techniques to actually fortify the damaged structures and get things moving the way they should, because no runner should have to stop running because they continue to hurt.
That's a good point, definitely. So hopefully you guys enjoyed this little pro tip. We'll be talking to you more later, and especially at different seminars and other educational events we'll have in the future so that you and maybe even your healthcare providers can learn more about this.
That's right. So check us out on YouTube, look us up on our webpage, wellwordmed.com, or just call us at 859-275-HURT or 275-4878.
And don't forget to listen to our podcasts. And of course, put your email in on these videos and we'll give you all the good information you need monthly.
And eat your vegetables and exercise every day.
All the stuff, all the good stuff.
For all of us here at Wellword, I'm Dr. Donish.
And I'm Dr. Escaloni.
And we wish you growth and joy in your Wellword way.